Thank you so much for being here to support this announcement today. A few months after I became Environment Minister, I was alarmed to learn that Alberta was on track to have the worst air quality in Canada. Testing under the direction of the Canadian Council of Ministers of Environment had found that air quality in the Red Deer region, for example, exceeded national standards for fine particulate matter. And that is important because levels of fine particulate matter have the potential to affect human health. Clearly, the time to take meaningful action on pollution in Alberta was long overdue. Yesterday, Premier Notley unveiled Alberta's Climate Leadership Plan. In only 6 months since our government was sworn in, we now have a plan in place to address the single greatest threat to our health and to our economy. That plan is a remarkable achievement. It is based on the advice of a blue ribbon panel of experts who relied on hard science, economic analyses, business and professional experience, and province-wide consultation and input of literally thousands of Albertans. And our plan represents a clear and dedicated commitment to Albertans' health, the quality of our environment, and our economic future. The plan aims to reduce pollution that contributes to climate change by putting a price on carbon and transitioning our electricity system away from coal emissions. As the Environment Minister, I can't talk about air quality, but the Minister of Health is better able to talk about the impact of Alberta's air quality on our health and our healthcare system. So, without further delay, I hand the podium over to my colleague, the Honourable Minister of Health, Sarah Hoffman.
Thank you very much, Mr. Phillips, and thank you everyone for joining us here today. I'm especially happy to see so many physicians and health experts who are dedicated to understanding and treating respiratory illness join us here today. And they're here for a very specific reason. Today's announcement specifically addresses the one thing that patients care most about in this building, the one thing that families worry most about, being able to breathe. Those of you who've ever had an asthma attack or witnessed somebody having one, you know what I say when I mean when you can't breathe, nothing else matters. And when a patient has to helplessly witness their when a parent, has to helplessly witness their child struggling for breath, nothing else matters. Sadly, it's a scene that plays out far too often in our province, as more than 10% of Albertans themselves have asthma. That's significantly above the national average. That's just one of the reasons why I take my job as seriously as I do, because those families need somebody to back them up. As Minister of Health, my job is to make sure that vital facilities, like the one we're in today, and the medical professionals and equipment in them are ready to serve Albertans when and where they need it. But there's more to my job than making sure proper treatment is available. It's also my job to reduce the need for treatment in the first place. It's also my job to improve the wellness of Albertans, to make it easier for all of us to live healthier lives. And that's why I'm so proud to be part of our government today. We're taking concrete action to reduce air pollution and make it easier for Albertans to breathe. We're doing this by phasing out emissions caused by coal-fired electricity generation in our province by 2030. Right now, 55% of Alberta's electricity is generated by coal, and that coal pollution is damaging Albertans' health. It's simple, but it's a simple equation, but one with serious consequences. Burning coal pollutes our air, causing respiratory illness in more people than any other way of generating energy. According to a 2008 report by the Canadian Medical Association, air pollution from coal power is hurting our province. It caused $300 million in healthcare costs each and every year. It causes 700 emergency visits every year. It's time for Alberta to move to cleaner sources of electricity, and that's what we are going to do. By reaching zero coal emissions by 2030, we will reduce ER visits, protect Albertans, and save hundreds of millions of dollars in costs that impact the healthcare system. Now, I want to point out that we're not the first province to figure out this simple equation. In fact, Alberta is rather late to the party. But now, we finally have a government in this province that's willing to do something about the impact of coal on human health and listen to the experts. We're going to generate electricity with new, cleaner forms of energy. And that simple step is going to have many positive benefits for Albertans. Developing cleaner forms of energy will help diversify our economy, and that in turn will create jobs, and that will result in a stronger economy for Alberta. But from my perspective, as Minister of Health, the greatest outcome for all will be cleaner air, which will mean a healthier Alberta.